Hi, this is Dr. Luke at ClearSight Center in Oklahoma City, Oklahoma, and this is how I perform Z-LASIK. So I start by numbing the eye and then checking for debris. I use BSS, which is a form of saline solution, in order to and then remove excess in order to allow the Zemer to apply suction more effectively. Here you see the Zemer laser, and I'm bringing the eye into perfect centration. And here you can see the Zemer laser beginning the creation of the LASIK flap. Now I absolutely love this laser. It uses a much lower laser than most femtosecond lasers. It provides a very accurate and precise flap. And it's also more versatile in other types of corneal refractive surgeries as well. So I'm very happy that we have this Zemer laser at ClearSight Center. Now, you can see that the flap has been created, and those bubbles are normal. Here again, I use a surgical sponge to check for debris. I bring the eye into better focus and use an instrument to lift the flap. Now you can see the air and bubbles being released at this point, and I use another instrument to lift the flap and break the remaining adhesions. Now, you can just see how perfectly accurate this flap is. I then reflect it or lift it back and bring the eye into perfect centration. I want to make sure that the head is positioned as well in order to treat astigmatism more effectively. And I use these crosshairs to make that adjustment. Here I'm using the EX500 excimer laser in order to bring the eye into focus. It is the fastest excimer laser in the United States, and it also has the fastest tracking system at this time. I then place a broad spectrum antibiotic and reposition the flap using BSS and this instrument. Now there's a natural pump in the eye called the endothelium, and that allows the flap to stick down. Now here I am making sure that the flap is in a perfect location and perfectly centered. I use a steroid drop to treat inflammation as well as to help me see the edges, or the medical term here is gutter. Now you can see that I check multiple times, and here I'm applying yet another antibiotic. Now it may be difficult to see, but the flap is nearly stuck down due to the natural action of the pump. I place the steroid one more time and check with a bright light to make sure that that flap is perfectly centered. I finish by placing a viscous tear in order to help the patient feel more comfortable. And now this patient is on his way to healing. Thank you.